number of issues going on that cause the discomfort. Here to talk more about it is Dr. Patrick Tomak, neurosurgeon with Hartford Healthcare's Air Neuroscience Institute at Midstate Medical Center. Doctor, welcome.
Thank you for having me.
Great to have you. I've had neck pain, and this can be awful. Explain what's going on in our neck as it relates to the spine and the symptoms that something's wrong.
Well, just to define a couple things, the neck we define as the cervical spine. So there's 7 vertebrae or bones in the neck with a disc that cushions each of the vertebrae. The discs allow us to have a lot of mobility in our neck, but those are the things that we strain over time. So repetitive use of cell phones, for example, we're holding our heads in a flexed position. The repetitive stress over time strains the discs, the ligaments, and we can wear out the disc and then cause neck pain, but then sometimes associated symptoms such as numbness, tingling, or arm pain, and those are more troubling findings.
All right, doctor, what causes these types of issues in the neck in the first place?
Well, just with normal wear and tear, most neck injuries are stress-related from everyday activities. As we age, the discs degenerate, the ligaments wear, and there's a critical point where the disc will start to bulge or herniate, and that oftentimes will cause the neck pain. But when the discs herniate and compress the spinal cord or the nerve roots, that's where people have more troubling symptoms, the numbness, tingling, arm pain, and problems with using their hands.
All right, doctor, talk about the latest and greatest treatments for neck pain.
Most, just to clarify, most neck things can be managed conservatively, non-surgical, but one of the newer things we're excited about, it's maybe not so new, but getting better acceptance, is disc replacement or disc arthroplasty, where when there's a need for surgery, we'll remove a herniated disc, but rather than fusing it and stiffening the segment, we'll use an artificial disc, which is a device that lets you maintain mobility, go back to normal activity sooner, and really live a normal life without the stiffness of a cervical fusion.
That's interesting. Wow. All right. What is the difference between a replacement and a fusion, and how do you determine who is a candidate for each?
A great question. A fusion is our traditional gold standard surgery. It's what we typically recommend, but a fusion is a surgery where we remove a disc herniation and then use a bone graft in its place and oftentimes fuse it with a small cervical plate. A disc replacement or arthroplasty is the same surgery where we remove the herniated disc, but instead of fusing the segment, we'll put an artificial device in the disc space that allows mobility, lets you keep normal motion in your neck, and then put less strain on the discs that you do still have. So the younger patients tend to be a better candidate for disc replacement, whereas older patients with arthritic changes oftentimes need a fusion.
All right, doctor, in 10 seconds, quick last question. When should someone seek medical help for a neck issue?
I think when people start developing neurologic symptoms, numbness, tingling, arm pain, that's with their neck pain, those are more concerning findings that need to see a specialist.
All right, Dr. Patrick Tomak, thank you very much for joining us.
Thank you very much.